Definition of health and illness. Health is a state of complete physical, mental, and social well-being, and not merely the absence of a disease or infirmity. World Health Organization. Illness is a condition of being unhealthy in your body or mind. Merriam-Webster Dictionary.
The other definitions of health and illness encompass certification and sick rolls. Certification increases doctors' legitimacy and represents an attempt to restrict the field. Conley, page 416. The sick roll is a term used in medical sociology regarding sickness and the rights and obligations of the affected. It is a concept created by American sociologist Talcott Parsons in 1951. Wikipedia.
These are our definitions of health and illness. Health is not only being free from disease and illness, but also being strong in mind, body, and spirit. Illness is based on the behaviors and symptoms one describes that suggest they are not in a normal state, but rather unhealthy in mind, body, or spirit.
We believe that certifications include board certifications, trainings, and an MD status. Increases legitimacy refers to being qualified or validated. Attempt to restrict the field refers to limited entry or reducing entry for physicians into the medical field. The sick roll is a concept that excuses actions that we would typically consider deviant from the norm, like not having a job or not properly taking care of oneself. When people are playing the sick role, we cannot make them wholly accountable for their actions. Changing a person's rights and responsibilities during their time of sickness reduces their expectations from society and allows people to recover and reduce the spread of disease.
We also interpreted the definition of certification to mean that doctors are allowed to treat sick patients because they have received the proper training and certification to carry out the tasks at hand. It is this extensive amount of certification and training that has allowed doctors to become one of the most well-respected groups of people in the United States.
One application of health and illness is when physicians take the Hippocratic Oath. The oath is recited following their graduation from medical school and pledges strong quality of care and ethical diligence to their patients. The oath also demonstrates the exclusive nature of the field of medicine.
Another application of health and illness is the sick roll. Here, a man is pictured receiving care from a nurse in a hospital. As a person in the sick roll, the patient is entitled to certain rights and obligations, like being cared for in a hospital setting.
There is one analogy that describes the certifications of physicians and their quality of care quite well. This relationship between the certifications of physicians and their quality of care is similar to the relationship between organic food rating and the healthiness of the food. For organic food to be certified, it often has to pass through rigorous screening processes and receive a high enough evaluation to be considered organic, similar to how a doctor has to go through years of training to receive a degree. These high standards force the quality to be higher because of the increased standards and examinations, similar to how doctors' quality of care would increase as they face more to become certified. One main difference between these relationships is that organic food prices can vary greatly, whereas healthcare costs are usually standard among physicians because of regulation by insurance companies. Furthermore, there are often gender inequalities among professionals. More women face unfair pay and status in their jobs, suggesting the role of gender in professions and professionals, especially in the medical field.
Gresham's law is when untrained people offer medical services and consequently drive down the price of the service. This causes good doctors to leave the market. Currently, the supply of doctors is quite limited, but the demand for their services is high. One potential solution is to keep the level of schooling and licensing the same, but to increase the level of training to remain consistent with the growth of the healthcare industry. One way to achieve this is to make larger classes at medical schools and have more medical schools in general. This would allow more physicians to achieve the same level of training. Other certification agencies like the AMA keep physicians at a high standard, such as avoiding amputating the incorrect leg.